most people with alopecia areata have had what's called intralesional Kenalog, and that is, I would probably say, the gold standard of treatment for anybody with 1 to 10 spots of hair loss. People for sure, everybody with alopecia areata has at some point been given a topical steroid, so a steroid liquid, lotion, cream, or ointment at some point in time. People have often been given, again, topical Protopic or Elidel, which are sort of non-steroid but steroid-like creams. So I would say probably most people have had those two things, and then beyond those things, some people have had the experience of using Rogaine. They've been told that they should use Rogaine, which is more for, well, it's entirely actually for people with male pattern or female pattern hair loss, not alopecia areata, but because it's a topical and it costs $5, everybody's been told to use it. So people have been told to do that. And then, again, less commonly, dermatologists will use topical irritants. So, again, creams or liquids that cause irritant contact dermatitis or allergic contact dermatitis. Examples of these being squaric acid, DPCP. Those are things that cause essentially a poison ivy-like reaction in the skin. And then anthralin is a good example of an agent that causes irritant contact dermatitis. And the whole idea with both of these is just to create enough inflammation or irritation in the skin that you sort of disrupt the immune reaction happening around the hair follicle to permit hair to grow. So uncommonly, but nevertheless, people still get those treatments sometimes. And then from there, you sort of move into systemic agents. So a lot of prednisone is used for more severe disease. Prednisone given in different ways, sometimes for days, sometimes for weeks, sometimes for months, sometimes big bursts, so once a month, but a mega dose. So that's prednisone. And then beyond prednisone, and so now we're kind of moving into the kind of less frequently used, or maybe even rarely used. People will give methotrexate, so basically kind of systemic immune suppressants. So methotrexate, cyclosporin, Cellcept, Imuran. Think of those agents as being things that people with like a kidney transplant or a lung transplant would use. So that's kind of the spectrum of treatment historically until JAK inhibitors, and certainly they're not being used commonly, but kind of more and more they're kind of becoming normal-ish to think about for severe disease.
Okay, and we'll get a little bit more into the JAK inhibitors in a little bit, but that gives me a really good spectrum of treatment. And how effective would you say some of the treatments you just went through are, specifically topicals versus the injections, and then the systemics?
Yeah, so I would say intralesional Kenalog is fairly effective for spots. My impression actually is, for somebody with truly mild disease, it's actually usually effective. Topicals, topical steroids, topical calcineurin inhibitors, so that's Protopic and Elidel that I mentioned, those don't work. And Rogaine definitely doesn't work.